Thank you, Jennifer. I'm going to, this is the outline of what I want to go over in my 20 minutes of fame here. I'd like to talk about the age of search, the era of intent, and the river of demand. Because I think that it's really important that we go back to first principles when it comes to understanding how people engage with us through social networks. I'd like to get specifically into some of what the data is telling us, because I see with a lot of our public health clients that there's a lot of rush to what's the shiny new thing. But the data is telling us something, and if we don't pay attention to the data, we might do investments which are perhaps not appropriate. Email is for adults. Jennifer alluded to it. Steve will talk about it. I think there's a consistent theme, and I'll give you some data around that. And I'll tee up this idea of, if public health is the platform, then disease are the applications, and the web is the pole. So what does all that mean? And finally, doesn't matter how good your idea is, if it doesn't spread, it doesn't win. And so social media is a really amplifying effect towards spreading of ideas. All good? All right. So what's this?
Searching engine.
Sorry, what'd you say?
Searching.
Search engine. Anybody else?
And the first popular search tool.
One of the popular search tools, a search tool. Anybody else?
It's a brand.
It's a brand. Anybody else?
A one-stop shop.
One-stop shop. It's getting close.
And
Platform.
It is definitely a platform.
Where it all begins.
It is your homepage. This is the world's homepage. This is your homepage. If anybody in your organization says, get it on the homepage, they're saying the wrong thing. Because the homepage of everybody is this. How many people disagree with me? How many of you have searched Google today? Hands up. Way up. All right, keep the hands in the air. How many of you searched on a brand? Like Coca-Cola, Nike, Ministry of Long-Term Health. How many of you searched on an issue? Cancer, asthma, hypertension. See, this is it. We search on issues. And if you search on an issue, because this becomes the homepage. Because the journey of discovery starts from here. So let's talk about this. The most expensive real estate right now in the world is here. Right here. This is the competitive marketplace of ideas in 2010. And the mission of my company is really, really simple. It is to take the best practices of the private sector and how they manage this channel and adapt them to a public sector and a nonprofit context. It's super simple. No dollar is spent without first trying to understand whether that dollar will turn something back to us. And in the private sector world, the most important thing is something called customer acquisition. We're all clients. We're all customers. We have to be acquired. And the cheapest, easiest way to acquire that client is through this. This is the competitive marketplace of idea. Hands in the air. How many look at the first page of search results? Second page. Keep your hand in the air if you look at second page. Third page. Look around. Fourth page. Look around. So there you go. This data is 80% look at the first, about 20-25% look at the second, and some fraction of people with too much time on their hand look at the third. This is the most expensive and most competitive place, real estate in the world. Now, the fascinating thing about it is that there's kind of two components to it. There's this thing called the paid search results right here, and the organic results. You pay to be ranked here or here, and you organically rank there by all kinds of work that you do. And it is not about stuffing keywords into the text. That is absolutely not the way that you rank there. So, question, how many of you click on these paid results? Hands in the air. Click on paid results. All right, for somebody that didn't put their hand in the air, tell me why. Just shout it out. Why do you know?
Paid results. It's an ad.
It's an ad. They're trying to sell me something. How many agree?
Yeah.
All right. Well, you're right. They're trying to sell you something. So here's the real thing. We do a lot of this work for our public health clients, and in a private sector, if we can get our clients to a 2 to 3% click-through rate on these things here, we get bonus. We get a bonus, a 2 to 3% click-through rate. In the public sector, public health space, the click-through rates for our clients are between 5 and 15%. 5 and 15%, multiple times. And the reason why is because when you see an ad here for something, for example, Ministry of Long-Term Health, or British Columbia Centre for Disease Control, or Ministère des Services de Santé Sociaux, you trust it. You're not trying to sell something. So the irony is that public health organizations benefit more from taking ads out here than any other type of organization. It's more cost effective. It's the most cost effective way of getting people to your site. And it's all about customer acquisition. Because if you build a website and it doesn't rank here, nobody's going to find you. So the other fascinating thing about Google is that it is a massive collector of demand. Massive collector of demand. Never before in human history have we had a way of understanding exactly what the crowd wants. This is totally new. So search is social. It's social because it collects demand of everybody. What you're looking at here is the trend from 2004 to a forecasted trend to the end of 2010 for searches in Canada on 4 subjects, actually 3. Diabetes, asthma, heart attack, and hypertension. So, which one is the most searched on subject in Canada of these 4 subjects? Diabetes. Right. But look at the trend. The trend is going down. And yet we all know that rates of diabetes are going up. So there's a disconnect there. Right? There's a disconnect there. So people are searching for diabetes information in orders of magnitude larger than they are for these other subjects. Where are they searching for it? Well, this graph down here, for the first time ever, we have the ability to understand where demand is concentrated. This graph here shows you the percentage of search by province as a percentage of overall searches. So the percentage of searches for diabetes as a percentage of total searches. And what you see is, oh my gosh, look at that, Northwest Territories. Highest percentage of searches on diabetes information relative to all searches in that province or territory. And is it a coincidence that there's a high rate of diabetes in that? Probably not. Probably not. So supply and demand. We in the public sector are fantastic about creating supply, but we're lousy at understanding demand. And yet now we have the best tool in the world to understand demand, which helps us to align supply, because otherwise, if you're debating what we should do and where we should put our resources in terms of developing content, it's positional-based bargaining around the table, really driven by people's egos. Is that a fair statement? Probably not.
Totally.
By the way, does anybody know what HIPPO is? HIPPO is an acronym that stands for Highest Paid Person's Opinion. HIPPO, Highest Paid Person's Opinion. And whenever I'm in a room and we're discussing this type of stuff, I always find the HIPPO rules in terms of what ends up going online. So here's that same graph, but what have we done in this case? We've simply added up one other search term, and that search term is the generic term of cancer. It's a generic term of cancer. And what you see is that cancer as a subject matter dwarfs everything else. The other thing that's fascinating about this is that these are chronic diseases, right? Chronic, which means that people have them for a long time. And therefore, these curves of demand are flat. They're not spiky. They're not spiky. They might go up, they might go down, but they're not spiky. And if you look here, now I've got for heart attack as a subject matter here, I'm looking at the incidence of heart attack, and you see that actually Manitoba and Yukon are the areas that have the highest percentage of searches for the word heart attack against all other searches. That's important information. Search is social. The other thing that's fascinating about search is that Google enables you to actually attach what are the words that people are searching related to this word. So what we see here is that when you search on the word heart attack, one of the rising searches is, well, here are the other ones, heart pain, heart attack pain, the heart, women heart attack, and rising searches is heart attack women. What this is telling us is that more people are searching about information about heart attack in women than in the past. This is important public health information. Search is social. This is social media, as far as we're concerned. So, we live in the age of search and the era of intent. And what I've just shown you is there's a river of demand. And that river of demand is being collected by Google. And by tapping into that river of demand, we as people that work in the public health space can better align the content that people want. The question now becomes, where do we distribute it?